Hello and welcome to the Reimagining Healthcare live stream. Just going to wait a few more seconds to see if we can get a few more just logging in. And sometimes there's a little bit of a lag with the live stream commencing and YouTube and Facebook sort of updating. But thanks for making the time today, everybody. I've got a great guest today by the name of Dr Kaye Frankcom. And we're going to be talking about telehealth adaptation for mental health professionals and the industry. Kaye is a highly accomplished businesswoman and leader in healthcare, as well as an endorsed clinical counselling psychologist, a insurance industry consultant, and an in-demand speaker and trainer, and has held a number of roles with various associations, which I'll let Kaye give us a little bit of an update on when I bring her on very shortly. So I'll just get you into the live stream, Kaye. Welcome, Kaye. How are you doing?
Good afternoon, Yianni. Very well, thanks.
That's great. I was just doing a little bit of an intro there for you. Perhaps you can give us an update as to what you're doing at the moment.
Well, like everybody, it's a bit of a scramble, isn't it? And I think we've all been surprised by the rapidity of which things have been changing, the responsiveness or otherwise of our various agencies, government, associations and so forth, just trying to work out how to best help the community cope with COVID-19 and how to sustain our health sector so that it will be here in the recovery phase, which will eventually come, and so that we can be of help in terms of mental health services in the community.
Yeah, there's a lot going on with telehealth item codes at the moment. So there's been a lot of behind the scenes kind of discussions with various associations and government on the telehealth item codes. What's the latest on that?
Well, it's great to see it's been settled as of today, Yianni, which is there is now an allowance for co-payments to be charged by psychologists. So we're not obligated to bulk bill except in certain categories which are clearly delineated in the latest information that has come out from the Australian Psychological Society, Medicare Australia, the government at all. And so that's really good news. And I hope it settles people down in at this point in time, because I think it's become the issue rather than the issue being really how can we be of service to our clients, how can we move them across to being engaged with telehealth, and how can we continue to retain clients and also attract new clients, because many practices are finding that that's been difficult. And it's easy to get caught up with the finances in terms of what's happening with Medicare, and not think about what am I going to do about people who are not coming through the door like they would normally, and how am I going to adapt my practice to cope with that.
Do you think that's kind of a normal response, because of the way that we've been used to doing things as an industry, and now we've had this really big impact? How do you kind of relate to that idea? Is it kind of a normal reaction given the circumstances, or are we kind of not seeing the wood for the trees?
Well, I think there's a bit of both, but I think in the first instance, it's a normal reaction for people to be disturbed when everything else is going to hell in a handbasket, and next minute you're told you're going to have to bulk bill everyone, and that's not your normal way of working. And plus, you need to go to telehealth, and plus, you've got all these restrictions on who can come into your practice or not, and you've got staff who are concerned, and you've got people trying to deal with trying to practice from home and homeschool and look after their families and look after their own health. It's a lot to deal with, and I guess part of it is just breathe, guys, just breathe, and just try and reach out to people who you can connect to and who can support you and can say, yes, it's difficult, but we're going to get there, because basically the community is relying on us being able to calm ourselves so we can be the voice of reason and we can be the mental health experts that we are normally. So I think these are unusual circumstances that, every time you read the paper, there's some economics expert telling you that there is no recession, nothing that is like this has ever been. So we're breaking new ground. That's obviously alarming. Some people feel very anxious about it. Of course, there's financial distress in many households, including our own. Can be where we're not necessarily geared to the idea that we may need to have contingencies in place when these sort of things happen. Because who could have thought that something like COVID-19 would come along? So mostly when we talk about contingency planning, we're talking about what if you died tomorrow, hit by a train or a bus or something. That's the usual idea about when you want to close down a practice because somebody's passed away unable to practice. This is completely different. This is a whole population thing, and it's a whole world thing. So I think all of these are part of the environment we're in.
So what would be your what would be your next step, given that we're in this situation, everybody's affected, so practitioners and clients alike? What would be the next step?
Well, let me pose a slightly different question that's on the same vein as that, which is, I think what we have to ask ourselves is this change that we're experiencing right now temporary, or is it something that we think will change forever? And so when we have temporary change, there are things that you can write out. So lockdowns and panic buying, the toilet paper saga, isolation even, fear and blame, being fearful of what's going to happen and blaming anybody you can think of. These are all normative reactions for both health professionals and the community, and let us hope that they are temporary. I think the things that are going to change forever, though, for us are things like digital health. All of a sudden, secure messaging is finally on the agenda for many people, many psychologists. And the idea that we continue to live in a world where we fax things to each other is got to go. Likewise, telehealth, something that has been sitting there as a resource, a possibility for us to use, is now front and centre. And I don't think it'll ever go back into the background. It may not be the most preferred option down the track when we can do face-to-face work again, but you would hope that people will now say, you know what, telehealth is a good option. It may be an area that we can then be able to see people and talk to people and help people who cannot leave their home and come to our offices easily. And maybe government will now support this in an appropriate way, because once they give you item numbers, they don't usually take them away in a hurry. Now, they've said that these will be reviewed. I get that. But if we can show that they are useful and that telehealth works, then there's a possibility that people who couldn't access psychological services easily due to difficulties with leaving their own homes can then access our services. Likewise, aged care, a whole bunch of places that really didn't have a lot of psychological services going into them can now potentially access that service down the track through telehealth if it's supported by government and the community. I think also some other things will have to change. We need to think about how we're engaging with people. We can't rely on the safety and control of our own offices anymore. So we now have to realise that in order to engage with somebody through telehealth in the same way I'm talking to you, Yianni, you have to really use your empathy skills. You have to really be good at active listening. You have to slow down and take time to basically get into the same space as that person is in. You have to check whether they're safe and comfortable to talk with you wherever they are. There is a whole bunch of things that in the past we took for granted when we had people coming into our space, into our clinical rooms, and where we set it all up the way it worked for us. Well, now that's not how it is. We have to actually acculturate ourselves to this telehealth environment and context and adapt our way of working with people. 50 minutes to 60 minutes on telehealth is a long time. And I've certainly been talking to psychologists who are saying, I can do 5 or 6 of those telehealth sessions with people and I'm absolutely whacked. That's it for me for the day, whereas I would have seen 6 or 7 perhaps clients on not every day, but on a regular basis and felt okay. It's quite exhausting offering telehealth to your clients. And 50 minutes to 60 minutes can be a long time. What are you going to talk about? Are you going to resume the treatment plan that you had with that person when you were seeing them face to face? I'm talking about current clients who you're trying to transition across. Have you made telephone contact with that person and reassured them that you can speak with them on whatever device and in whatever fashion will work for them to start with as you transition them to something like a telehealth platform that is more acceptable in terms of privacy? Have you paved the way so that that person can feel that you are with them, that you are their mental health expert, their health coach? You understand how health anxiety works, which is really where the focus of a lot of our initial work should be with clients when we start with them via a telehealth context. So all of these things are part of the things that I don't think we can go back to afterwards and go, well, we don't have to worry about that stuff anymore because we're not doing telehealth. The final thing I just mentioned is something that's very dear to my heart, which is outcome measurement, that we are going to have to face up to the idea that we don't know whether our treatment is effective unless we measure it. So people need to start to embrace outcome measurement, of which now there are many ways of doing it that are very easy and automated. And if we engage with our clients around the idea that we need to know how they're going overall, what their well-being is like, so that we can know whether we're actually having any impact with our treatment, and we're also going to ask them for feedback on how effective the session was, that also creates a bookend, asking about the well-being at the start, asking about the session and how they rated it at the end. But that can actually create a sense of containment and holding, which is very important in most therapeutic work. So it's time to embrace these things that many psychologists have said to me, I haven't got time for that. Yes, it's a great idea, but it's just too hard and so forth. No more saying it's too hard to have a practice management software package that you're using regularly. No more saying I'm going to operate my practice out of a Gmail account, an Excel spreadsheet and a mobile phone. This is a professional profession and we need to embrace that. And I think we're now being forced to really think about what does that mean for us. So ends the rant. Yianni, your thoughts?
Well, I think it's a great opportunity. I don't think COVID-19 is something for us to sort of think, look, this will just be a temporary thing and then we'll just go back to how things were. I think it's a watershed moment. I think it's like a lot of really significant events historically where life never is the same, afterwards. And when you think about it at a pragmatic level, now that we in the Western world have experienced a biosecurity threat of this magnitude, we all have to have disaster recovery now, factoring this in. It's probably always been a line item in the disaster recovery of most businesses, how they operate, and particularly how a government operates. So I think always being ready to be able to go to the digital bunker, so to speak, in the context of an emergency down the road. And how does our population actually survive through that type of threat or that kind of attack? Whatever we do now gives us something towards having that kind of response ready for next time. Now it's very disruptive. Now it's all very new. But we would have gone through this. We would have thought about what the impact is. And so it helps us with the future state. But aside from sort of, doom and gloom type casting, from my point of view, I see the opportunity to not just survive this kind of situation, but actually thrive and do that in a way that is now kind of, a total reimagination opportunity, subject to what your clients think. If what we're seeing now is a lot of people are staying at home, and we're already seeing, through the digital marketing channels, for example, there's different behaviour. A couple of months ago, for example, you could predict when most of the peak observations of social media posts and content would typically happen, whether that was a certain time of the day, a certain time in the evening, which particular days during the week were more popular than others. And that was because we were living a life where people were commuting and we're sort of building ourselves around this kind of 9 to 5, type model, 8 to 6. I know different people kind of have a slightly different coverage window. But now that everyone's kind of at home, the idea of 9 to 5 doesn't have to hold as the only way going forward. We're dealing with children, we're doing homeschooling, we're isolating ourselves. So, maybe it's better to get access to healthcare at a different time of day. And I think that's kind of, a potential opportunity for the healthcare sector to think about as well. A coverage window could actually shift. And I think it's really important to think that through. What is your scheduling going to look like in the context of everybody predominantly self-isolating and staying at home? is it possible to, rather than try and just stick to a 9 to 5 kind of practice opening hours model, that it might actually be, 7 till 11 p.m. or, 4 till 9, or, some other kind of coverage window, 2 p.m. till 5 p.m. We don't have to necessarily be constrained with digital health and with telehealth in particular. I think the ultimate person to ask is your client, and try and figure out what is a good fit, and then sort of incorporate that balance in your own lifestyle as well. So I think coverage window, scheduling, allowing buffers. It's kind of interesting, that comment you made, Kaye, about the fatigue around video. It is a kind of new experience to adopt, but it's going to take once, twice, 3 times, and as you start to do it more and more, it starts to become, you're less conscious of it after a while, and it's easier to actually kind of relax into the actual communication and feel not as drained at the end of it, not as high concentration perhaps as because of the technology. So I think that'll pass over time, but I'd really encourage people to use scheduling, a coverage window, and have buffers in between the appointments to make sure you can sort of get off and hydrate, maybe have a little snack, maybe stretch the legs a little bit around the house, and just look after yourselves through the process. I think, Kaye, you talk about this as well. You talk about the self-care when we're talking last time for the practice owners. Do you want to share a little bit more about your thoughts there?
Well, I think part of it is about thinking about how you're going to, like, just talking about the actual individual telehealth sessions that you're offering to clients, is how are you going to fill that space, and how are you going to make it more comfortable and more familiar for yourself and for them? So for me, it's about thinking about, well, am I professionally dressed and in a sort of space that looks not like an office, but at least not like my bedroom, or like somewhere that people would think, what is she doing? And that's an odd looking space that she's in. That might be important to some people, and it might be completely irrelevant to others. So these are some of the things to be considering, is just about how do the clients perceive us? What are they expecting from us? Of course, most people are absorbed in their own stuff. So clients are no different. They're going to be thinking about what they want to talk about, but I guess they're also going to be looking to us to create some kind of structure for them. So part of it is about having some planned things that you could actually discuss with a client that are likely to be common to most of our clients. And one of them is health anxiety, which I've been talking a bit about on some of the webinars and things I've been offering to various people, and talking about things like, how do you plan out a session which focuses on how people can handle their anxiety about their health, which of course is completely understandable in this very abnormal situation we find ourselves in. But the fear of dying it has been around for a long time. And we know quite a bit about the fact that usually anxiety is exacerbated by fears around things not being predictable and the need for certainty. So then you can construct, if you like, a psychoeducative process around how COVID-19 fits to that story, and what's going on with the media, and are some of your clients watching way too much media and therefore exacerbating their anxiety, triggering anxiety, and how do we actually hold back from ruminating and going over the issues of anxiety, the issues that are making us anxious and making those things worse, or alternatively just wanting to avoid it all and shut ourselves off from everything, which often doesn't work. So I think it's really about thinking about, how am I going to educate and treat and help this person with their health anxiety as they experience it, but bringing to bear some standard issues that are common to most people who are suffering our health anxiety. And you could say the same about topics such as depression and isolation, about managing problem solving in emotionally distressing times. What do we do when our problem solving processes seem to be breaking down? How do we help our clients to get back on track with that? Now, I'm talking about client work now, but I may as well be talking about what it's like to be a practice director, Yianni, because people who are practice directors are going through this similar sort of issues. how to actually be able to problem solve in these quite distressing environments where suddenly their practice, which they thought was going fine, is actually floundering, or where they've had to face up to some of the financial difficulties that they've been fudging for a fair while and not really recognising as being problematic long term. What about the dealing with their staff? Which staff are going to come on board and be able to shoulder some of the load of seeing clients? Which ones are going to really struggle with this? How are they going to manage those people while managing themselves? This is the same as a psychologist managing themselves and managing their client. So there's lots of parallel processes, as we call them, Yianni, and sometimes that can be pretty overwhelming. And I really would encourage people to reach out and be talking to other practice owners, talking to other psychologists, talking to their advisors and mentors, so that they can get another perspective. Because often once you start talking with somebody, you actually start to realize, I've got some of the answers here. I just wasn't able to see those because I kind of got caught up in my own distress or anxiety about the what ifs. And we know that anxiety is driven by what ifs. So you can see that in preparing for dealing with anxiety with your clients, you're kind of reconnecting yourself with a way to deal with your own anxieties about your practice.
I think it's really great advice. I guess another thing to think about is that, the digital tools have been available for a while, and you've already named a few of those, Kaye. Thank you for that. The secure messaging for healthcare communication between different points of care, whether it's reporting back to a GP or receiving e-referrals, whether it's other kind of sharing of healthcare information with different points of care. There's the telehealth, which is a lot of people at the moment seem to think it's video, and video is an important part of it, but it could also be voice in terms of a telephone call. It could be SMS communication or chat-based communication as well. So it's the idea of being able to actually think about it as no limits right now. That most of the relationship between the practitioner and the client can be facilitated via those modalities. And the evidence for that is that there are mental health providers out there who for some time now have been 100% online. They actually don't do in-clinic services at all. And there are other mental health providers out there who are 100% chat. And there are other mental health providers and support systems that are 100% voice. So I don't think there's a question on whether it can work. I think the mindset is really important. What do you say to that, Kaye?
Yes, I think the mindset is very important, because I think we can get stuck with a particular mindset around any particular topic. So, for example, the topic or the issue of confidentiality and privacy, which has become very much at the forefront of these questions about telehealth, where everybody wants to talk about which platforms most, going to meet the privacy considerations, and what's going to be the most confidential way of speaking with people, and wanting to set up something that's a perfect environment, at least from the point of view sometimes of the psychologist rather than the client. And I guess I say that the difficulty with confidentiality is people get it mixed up with really what I think they're often talking about, which is secrecy. And in my experience, that probably isn't really all that helpful. It's much more important that we actually create access, and that we actually reach out to our clients, give them a call. How are you going? We haven't seen each other for a few weeks. It's been, a storm of things going on. Where are you up to? What's your thoughts? Here's what we're looking to offer. Have you seen our emails? Have you seen some of the materials coming through? How can I help? That is really a way to reach out in a very basic human way. And I think we've got to be really clear about the fact that what we need right now is more humanity and more humane treatment of each other, being able to be more real with people, to disclose the fact that we're struggling to kind of set things up and get things right, but we're on it. We're, for those of us who have not been in the digital world in the same way that you're describing in some practices, that we are able to transition, and quite quickly, but we need to be more nimble. We need to do what I know the tech world talks about, the pivot. We need to be able to turn something around, and not to treat it like the Titanic that's going to, take 3 years to kind of make it happen. We are going to have to coin another travel. It must be because I really want to be on holidays, but instead I'm sitting here talking to you. We're building the plane as we're flying it. All those analogies are true, But I think it's really important that we think about the client's needs and how can we actually cater to that, and stop thinking so much about our own anxieties and fears that we're not following the right confidentiality or privacy provisions. If somebody is willing to do telehealth with you, then you need a verbal consent from them. You need to go through them, the ins and outs of how it works, and then you can follow up with a proper written consent, of which there are now a few different templates around, which I encourage people to use. No need to reinvent the wheel. Plenty of people are both the professional associations, but individual practitioners are putting examples out there. Use those templates, but actually saying to your client, are you okay with the fact that we can just talk on the phone, or that we could have a video conference? So I think it's that kind of idea that we need to really be working hard on.
I've just popped up a question, and I'm gonna get a question up in a moment from Brian McDonald, Kaye, who has a question for you in the live stream. But one thing that comes to mind for me is that when you think about digital health and digital healthcare, is looking at it through, if you kind of take that client centric type of view. This is a really powerful question that informs the way that the healthcare service can actually be evolved over time, not all at once, but just iterated slowly but surely to meet the needs of the clients, and clients who live in a modern age, who live in any way, even when we're moving around cities and countries, there's still a lot of distance to cover. And so, I think it's really a powerful question. How does healthcare fit into the lives, schedules, goals, and aspirations of your clients? And a really good, useful way to learn that is to discuss it with your clients and get some kind of feedback. You can lead potentially by offering some suggestions. The telehealth capabilities that Core Plus is offering allow for documentation and consent forms to be put forward in front of the client during the booking process, which kind of allows you to modify your clinical governance model to be digital clinical governance as well, and allow those templates to come into play. But I thought I'll just share that particular question, because I think it's a foundational question for thinking about digital health and how we actually do it.
Well, I like your use of my favourite term, clinical governance, and I think what you're really saying is, does the clinical governance serve the clients? Now, it has to serve the clients in terms of effective healthcare and safety, and that's really what we need to be thinking about, rather than is it serving our needs, where we want to work in a certain way, in a certain, over a certain time in a certain place. Sometimes it can't be that way, or there has to be compromises. There has to be, if you want to take up business opportunities, you're going to have to challenge yourself on this. Even doing things like opening up the client portal and letting clients make their own bookings. This is something that a lot of psychologists would never they would never kind of consider, because they would find that just too difficult to relinquish that control. These are all the clinical governance questions that are certainly going to be on the agenda now that we're all working remotely, generally speaking. And we just need to loosen some of these ideas up and think about them, and think about who are they really serving.
Fantastic. And here's another example of some thought around where the population is kind of moving, not just because of COVID-19, but because of the internet. And the internet's been with us for a very long time. And, we've been slowly but surely learning how to consume online, how to purchase goods and services, how to pay for things, how to build our social networks and relationships online. There's nothing really radical anymore about the idea of being able to provide goods or services online. And so healthcare has that opportunity by sort of understanding that each generation that comes through is more and more entrenched with the online world, and their reality and their life and their experience is somewhere between the real world, the physical world, and the online world. And so if we can think about that as designing an experience, designing something that actually incorporates digital health thinking to actually provide a remotely accessible healthcare service at a coverage window that aligns with the client's needs, and that allows them to, be wherever they need to be at a given point in time, and still be able to access their healthcare practitioner and support network through that particular period of time. Kaye, Brian's got a question here. I'm just going to pop it up on the screen for everyone to see. Thank you, Brian, for the question. Good conversation, Kaye. You mentioned measuring clinical outcomes from telehealth consultations. What do you suggest are ways of evaluating clinical outcomes and whether the mode was effective?
Brian, thanks so much for your question. It's a key question at this point in time, I think, because we are at a point where we can actually measure clinical effectiveness and address it through our knowledge of the research into health outcomes for people who have been engaging with psychological services. We've got outcome data that's probably been collected over about a 50-year period. And what that outcome data says is that something like 47% of people who front up for mental health treatment drop out before they actually get the care they need. So they often drop out before they've done 2 to 3 sessions and they have not reached what we call reliable change. So the reason we know that is because we think the reasoning behind that is, and the reason that occurs is because people are not engaged with a service that is not necessarily following what their needs are, but is more following protocols and particular approaches that are relevant to the clinician and to the therapy. So measuring clinical outcomes means, first of all, getting a baseline measure of somebody's overall well-being, not necessarily their depression or anxiety or stress, which we often do measure, but actually how are you going overall? And the outcome measure I would suggest is a measure called the Outcome Rating Scale, which you can download for free from scottdmiller.com, who is a long-standing proponent of outcome measurement. And you give that measurement at the start of the session. You can give it digitally if you sign up to some of the some of the apps you can see that are cited on his particular website. And they will send out a email link for the person to be able to give you their particular ratings for their well-being it's basically supplied on 4 domains: how they've been feeling individually in a score out of 10 over the last week, how they've been feeling socially, interpersonally, and overall. So it's overall score out of 40, and that can be come back to you through through the portal that they use for that particular program. Then at the end of the program, you would give the session rating scale. So this is really measuring the therapeutic alliance. The reason we measure that is because we know it's the greatest predictor of variance or outcome in terms of therapy. So we're really looking to see what was the client's experience of the therapy. And again, it's 4 lines with scores out of 10. Again, the person would give that score and it would come through to you and it would go onto a graph that you can share with the client. So that score would be looking at how was the relationship out of 10, how are the goals and topics, the means and methods by which those topics were pursued, and overall how would you rate out of 10 the session. So that's a quick kind of bird's eye view of that, but happy to speak to you about it further if you'd like. It's the way of the future. It will, in my view, it will continue then to show government and anybody else who's asking that psychologists are effective, that we can provide services that are worth funding and worth continuing to support. And that is always the risk for us as we become more and more Medicare reliant, is how do we show that we're any better than other health professionals who are also in this space? Now, it's not a competition, but my point is that outcome measurement is one way to demonstrate your own effectiveness to yourself and to your clients. It's also a way to make sure that people don't drop out before they are actually getting benefit from treatment. And if you've gone to the trouble of getting a care plan, you don't want that person to give up before they've actually had the opportunity to really engage with you.
Thank you, Kaye. Brian, just acknowledging that answer there. Thank you very much, Brian, for doing that and for engaging with the live stream as well.
Thanks,
so we've sent out a link there for the Scott D. Miller website on some of those measures. I'm going to pop up another screen here just to share and discuss the idea of how the health tech tools can actually work. Thinking about it through the eyes of the client, the TeleConsult functionality that Core Plus is supporting telehealth capabilities with has right now an ability to make it a fairly easy intake process through the online booking capability that I mentioned earlier. But at the end of the day, you're going to have your clients show up for their first video consultation. And so part of thinking through the experience, that digital healthcare experience that I was describing earlier, is having in mind that for you as a practitioner and for your team, as well as for your client and your clients, this is going to be a first-time experience. And so it's good to actually have the system set up in a way where the tech can be checked very quickly that it's working properly. And you really don't want the tech to be in the way of delivering the healthcare consultation. And so a really easy way to do that is when the booking confirmations go out, there's just a simple URL that's sent to your client with whatever formatted message you want to send through SMS or email. And so your client can just simply click on that at the appointed time and they enter a guest waiting room. And so they're now in a session, they're waiting for you to actually open up that virtual room and commence engaging with them. So you have some control over the initiation of that virtual room or virtual treatment room or virtual clinic. And there's a little tech test there to run a speed test to make sure the internet's working okay. And there's an opportunity then for the client to have if things are really bad, for example, and their tech is not working, they've got an opportunity to escalate that with you and find a different way. So it might be a phone call as a backup or perhaps having an alternative telehealth compliant system just in case the primary one doesn't work. At the moment, our availability and reliability is excellent. But with tech, as we all know, sometimes things can go wrong and you're only as strong as your weakest link. So keep that in mind. I'm just prefacing that, Kay, to the point, to the answers to Brian's question there. On the other side of the session, when you've finished, there is a survey that goes out. Now, at the moment, with the current implementation of telehealth with Core Plus, that's not customizable yet. However, we are actively working now on a next release will allow you to actually design and customize your own surveys and your own kind of feedback questionnaires after the session. So that should really empower the Scott D. Miller method, Kay, from your point of view, or whatever session rating scales you want to actually work with. You'll be able to actually incorporate those into that end of session kind of feedback. And then on the other side, for the next appointment subsequent to that, you'll have the customizable intake form functionality within the booking framework, which will allow you to actually then design the next piece of communication or the next little update that you need. So we're really actively working on making sure that we can give you that kind of patient-reported experience feedback or patient-reported outcome type of measurement statistics coming back into your clinical workflows there as well.
So one of the interesting things just to say about this kind of concept that I think is really, again, something we want to keep on building after we go into the recovery phase after COVID-19 is that we're seeing more and more that people are really wanting to engage with us via email and SMS in terms of the intake process. They don't necessarily need to talk to us. The good old days, bad old days, whichever way you want to see them, you used to have to talk, ring up the psychologist and talk to them or talk to their receptionist and ask about, the fees and the whatever. A lot of people much more comfortable receiving that information digitally and interacting with you through the digital medium. Second thing is that what's coming through already with telehealth in talking to people who are using outcome measures like the ones I just described, is that they're finding, interestingly, that the session ratings they're getting back are more negative. And you might go, oh, that's no good, that can't be good. But actually what they're getting is more constructive feedback. So if you tell a psychologist that their session was 40 out of 40, one, I think it can't be perfect, which is really what that measure is saying. And secondly, it's not really feedback. It doesn't really give you anything to work on or to enhance or to think about how could I have done that differently, and I'm pretty sure that most people, when they've gone through a session with a psychologist, have got things they'd like to say about how the psychology treatment was, but often are too they worry about social this what we call a social desirability, in other words, social pressure. They don't want to upset the psychologist. After all, the psychologist is supposed to be helping them. So to encourage people to give us negative feedback is quite difficult. But interestingly, since telehealth has been going on, I've had, and this is only 4 or 5 people who've talked to me about this all individually, which is quite interesting, saying, I'm getting really good negative feedback. I'm getting accurate feedback. I'm getting constructive criticism. People are saying, look, I really wanted to talk about these goals and topics around these things, but you actually sort of went back to talking about what was happening before COVID happened. And I really wanted to talk more about my crisis management at the moment. So that was gold for the psychologist, because then they knew, I know now what I need to prep for the next session, and I know what my focus will be. And so that enhances the engagement. It means the psychologist is working closely with what the client's needs are. Whereas they wouldn't have known that if they hadn't had a method by which they could ask for that feedback. What you're describing, which is customized forms and things, sounds great. To some degree, they're more like customer feedback. And that's perhaps a slightly different concept to what I'm talking about, but probably more in the way that it's being administered. Either way, feedback is really what we're looking for. And the idea that we know what's best for the client is just not true. It has not been shown to be the predictor of a positive outcome for mental health treatment. Much more important that we can get that so-called negative feedback or constructive criticism, constructive comment from our clients, that they can then collaborate with us around what they need, and then we can actually bring that to the table.
Thanks, Kaye, and I appreciate the distinction there. I do think that in, I guess, more health tech terms, the ability to build out proms and prems and support that kind of either practitioner by practitioner or sector by sector type approach, there's still a little bit of water that needs to flow under the bridge to get us to that kind of point of view. So I think the feedback tools are coming. And I think, just being able to work with some of your suggestions there as well makes a lot of sense, to be able to use the approach in some way that can actually work within the clinical system as well, whether it's through the letter writer functionality or through having some kind of standardized documentation that allows that client to be able to complete it. I was having a look at a product very recently that it's not aimed at mental health care, but it deals with body charting and getting kind of feedback into that process for physical therapies, as an example. And what we were seeing there is that the practitioner was actually engaging with the client online to complete that kind of information, and so the form and the feedback actually became part of the online experience rather than being this separate thing that happened in isolation of the actual treatment. Is that something that you'd be suggesting would be a good?
Yeah, so the outcome rating scale, the initial, or whatever method you would want to be measuring well-being, is really a way of interacting with the client around how are they going overall, and putting a graph over time. And so that you can actually keep a record of it, because if you don't measure it, it doesn't really happen, as they say. So I think that's part of the idea, is that it actually creates this collaborative conversation. And if things are going in the right direction, okay, but if they're not, then you can stop and say, now wait a minute, we were going, the trajectory was going this way or this way, but now it seems to be going this way. What does that mean? What do we need to do to respond to that? What is happening in your life that the therapy isn't necessarily assisting with? It's not to say that therapy is the answer to all problems, but it must respond to the overall status of that client. And the session rating scale is the same. It's not. It basically says to the client, the psychologist can't read your mind. They can't know what you're thinking or feeling. They can only guess from their often extensive training and experience what they think is going on. But what's really important is what you think is helping or not helping. That's what we really want to know about. As I often say, is there anything that did or didn't happen today that would mean that you wouldn't come back to the next session? That's really what I need to know.
I think it's great advice. Thank you, Kaye. Another thing that comes to mind, you were sort of touching on it earlier, is the idea that, okay, so we look after ourselves, we make sure that we're in a good place. We kind of keep ourselves healthy and strong, and now we're thinking about our clients, and we're thinking about how we actually transition into this kind of online healthcare type of delivery model. And you sort of touched on secure messaging a little bit earlier. I wanted to share another slide that kind of goes towards that, because I think what you've encapsulated is something that I really like to talk about, and that's actually kind of a 360-degree virtual clinical kind of model. It's not to say that you don't do anything in clinic face-to-face, but the actual data flows and the way the information flows can be actually fully virtualized. And I think it's really important for health practitioners to think about this as being integrated and seamless, whether it's between yourself and your client or whether it's between yourself and a referrer. Having all of that workflow seamlessly integrated so that you are delivering an online consultation, but you're still actually doing the workflows as though you were in clinic, so to speak, but all in the digital realm at the moment. And there's so much opportunity to do that, whether it's not just your referrers, but also your team members, any alliances and cooperations that that you're working with, other collaborations, payers, obviously Medicare and DBA is pretty big ones for the time being. But there's even CPD courses that are developing online as well, and have been for some time, but now even more so than ever. So there's so much opportunity. I don't think there's any structural impediments to actually being able to make this work as a fully virtualized kind of clinical workflow. What do you think, Kaye?
Yes, I think that's right, and I always say always automate what you can, because I think a lot of the time because psychologists often are not very good about thinking in a business context. They'll just think this is going to cost money, therefore it's going to be something I can't afford to do. I guess I'd say there's a lot of things we're talking about. I would say in the next couple of years you won't be able to, you'll have to afford to do. You can't really avoid them. It will be required as part of practice to have secure messaging. We've fluffed around it. We've put up with GPs faxing us, because it's been too expensive or too difficult to get a secure messaging process either embedded as it is with Core Plus into a practice management application, or or just being able to actually afford to pay separately for a secure messaging service such as medical objects or whatever. All these things are now going to become something that need to all be in the one place. They need to be something that can be accessed both by allied health, pharmacists, GPs, our referrers, the third-party payers. There needs to be a process that makes automation the given, if you like. And I guess the only thing to say about that is the one thing you can't automate is relationships, Yianni. And so it's really important that you reach out to people. I was saying before about how many people prefer emails and texts and so forth, and quite happy to interact with you that way. But eventually they want to actually talk to a person. They wanted to build a relationship with a person. And that really, psychological treatment in particular is where you're using your sense of self. You're using who you are in order to engage with that client, and you are the instrument by which the treatment is prosecuted. So it's important to see that piece as being something that will continue, as far as I know, as long as psychological treatment exists in any shape or form, or therapy exists in any shape or form. But these ways of making automated the things that can really support our practices, it's vital. It's the main game. Because we just will not be able to move forward if we can't do that. We won't be able to service the needs of our ongoing populations who are on the move, who do want services outside of 9 to 5, who are happy to talk digitally with somebody, or happy to access, as you say, a chat-based service or whatever. We've got to get our minds into a bigger place. We have to think outside of our comfort zone, while at the moment we feel like we just want to hunker down and kind of hide and just protect everything that is ours, while COVID-19 appears to be bombarding us. I guess I say that's true, and that is how it can feel, but also think beyond that. Think about what could come from this. Think about the things that you haven't really invested in that could actually now take your practice into the next 10 years or more.
Thank you, Kaye. That's definitely good advice. There's a couple of points I want to get across around the opportunity side of it as well. So as we sort of we deal with the reaction and the crisis and all of this media attention that's on COVID-19, our lives start to change. But the opportunities are now that when you are connected to a digital health platform like Core Plus, you're also electronically connected to other points of care. And there's so many unspoken benefits about this. I really work really hard to try and talk about this around various talks that I do in the industry. That a lot of practices spend a lot of time, money, and effort trying to, for example, attract new clients using Google and pay per click type strategies, which Google is brilliant at and very effective. In fact, Google's more brilliant at getting advertising dollars out of small businesses. But when you think about it, demand isn't really the problem. Like, we already know that we've got a growing mental health disease burden on the Australian healthcare workforce. It's the third largest disease burden on the healthcare system, and now more so than ever. So the demand for mental health care services is not the issue. What has been the issue, I guess, in a way, has been that it's not always been convenient or easy to access. The type of the actual physical process of getting access to mental health care has actually in part been an impediment for members of the community. And so by being able to actually recontextualize that in our heads, what we can now say is that we've sort of removed a barrier, because if somebody's sitting in the convenience of their home and they require access to mental health care, well, it's in the palm of their hand. It's the phone that they've got, or it's the laptop or the PC that they're working with. So we've, in a way, the opportunity here is that the accessing mental health care barriers, in part, have now sort of broken down, and in a way we're being encouraged, if not nurtured along, to actually try it like this. So there's a fantastic opportunity, and if you can do that, if you can sort of get your head around that, and then start to realize that you're no longer geographically bound either. It's no longer about the postcode that your practice is located at, because let's face it, it's traditionally has been a limitation. Nobody's going to necessarily fly in from Darwin to go to a South Melbourne practice. There's always a locality in the way that the healthcare delivery model has worked up until now. And so the way you market, the way you promote, the way you present yourself in terms of prospective interest with your services was built around that kind of thinking. Well, guess what? Now with the internet, you can market your services pretty much Australia-wide. And, it sort of brings us back to those topics earlier around what coverage window are you providing in terms of people to be able to access your mental health care services. Retention of your existing clients and working through their needs would be your first priority. But then above and beyond that, you now have an opportunity to make yourself available to anyone around Australia in your area of specialisation, so to speak. So keep that in mind, that this is an expansion opportunity. This is a growth opportunity. It's not a constraint or a decline opportunity. It's quite the opposite. It's really just embracing that and incorporating that into your marketing strategies. Really important. On the other side, to the point around the demand that exists for people wanting to access mental health care services, is that other points of care are talking to those people as well. The most sort of notorious one would be the general practitioner. General practitioners now can't necessarily give pieces of paper and hand it over to people. I'm hearing from some GPs at the moment that they're pivoting the majority of their clients now to online, and really only dealing in clinic where they absolutely have to. And so secure messaging and that electronic communication has now taken on a whole new level of what in marketing terms is called new client acquisition. So it's something to think about there as well, where the GP down the road now has a system which is a directory. It's a national directory, and they can actually look up a mental health care provider by name, by provider number, by area of specialisation, as an example, And so getting onto that directory and activating secure messaging provides you with a fantastic opportunity to actually become available when a GP or another referrer is actually looking to refer somebody to your service. Geography is no longer a limitation. It's now whether you're telehealth enabled and telehealth ready that will make a difference on whether that referral is potentially going to come your way or not. What do you say to that, Kaye?
Yes, and I think, you know, it is about reaching out to, you know, people are sort of sitting there going, you know, all of a sudden the new referrals are dried up because we don't have our clinic doors open. I guess I say, well, have you rung? First of all, have you rung your GPs? Have you made contact with them via telecommunications, via video conferencing? Have you made contact with your clients who might be just waiting to see what you're going to do and what you're going to be prepared to offer? You need to be proactive rather than saying, oh my gosh, you know, the place is falling down, you know, the sky's, you know, going to fall in, because we used to get, you know, X number of clients contacting us as new referrals, and now we have got none or very few. It isn't necessarily the case. This is a lull in some respects, in my view, before the storm. And I'm not saying you want to go out looking for the storm right now, because you might be still trying to get yourself set up. But I think it is about thinking, okay, well, where are the clients going to come from? And how am I going to get myself out there without investing, as you say, large amounts of money in Google Ads and the rest, which probably won't necessarily help you right now. It might down the track, but not now. And if you don't understand about marketing, then don't go and do it on your own. You'll only get yourself into trouble and waste money. So, you know, you need to get in touch with people who are used to marketing allied health. You need to get a practice management software program that actually allows you to do all of the things that we've been talking about today. And as you know, I'm not here to, you know, to pump up Core Plus. You can do that on your own, well and truly, without my help. But there is so much that as a practice director you need to think about, and to really get a clear picture of what am I going to need to go forward, and how am I going to deal with what's going on now, which might be that we're still our doors are partially open. We're still seeing some face-to-face people. Some people are still doing face-to-face work. We're doing this transition to telehealth, but we've got this lack of new referrals coming through. There's a lot of moving parts, but we need to really be proactive in trying to manage those relationships, to let the GPs know we're still here. And to think about those GPs that are outside of our immediate area. Well, who are they sending people to? Who else is there out there? I often say, you know, in general psychology, community-based practice, you'll have probably 20 or 30 GPs who send you maybe the bulk of the clients for your practice. But what about the other 150 who send you 2 or 3 a year? What's the story with them? Have you ever called them and said, what stops you from sending us more people? What is it I can help you with that would lead to you seeing our practices more worthwhile? We are telehealth ready. We have got psychologists who are ready to take on new clients and who are excited at the idea of being able to use telehealth in this crisis stage we're in at the moment. So there are possibilities there. You just have to turn your mind to them rather than getting caught up in the fear and blame game. And you need to move forward into that space and do it confidently, with the right things in place, but also with yourself in the front as the relationship builder, the connector, who's going to create access for those clients who are sitting somewhere, not too sure where to go or how to get help from a mental health expert.
Thank you, Kaye. That's fantastic. Just in the short time we have left, there's another question in from Brian. And it's just one more slide that I want to touch on, Kaye, that I think encapsulates what you were just sort of describing. I love that be a connector idea that you just sort of put out there and facilitate those relationships. So Brian's question is, I'll just pop it up now. How has the recent social distancing, self-isolation and legislation changes suddenly increasing unemployment affected mental health services, and what should happen next?
Well, I think those things are probably have affected mental health services. Probably in the social distancing area, it's meant that waiting, you know, if you're seeing people face to face, we're having people only having a certain number of people in the waiting room at any one time, and people having to make gaps in appointments and this type of stuff. Self-isolation has meant that telehealth is ramped up and people are ready, hopefully, to be able to talk to their psychologists through telehealth means so that they can self-isolate, and so there's no risk to themselves or to anyone else. The legislative changes, I guess we've had a number of them in a number of areas. I would be hopeful that these stimulus packages will assist our unemployment. There is going to be unemployment. And I think the way mental health services are going to have to deal with this is have a range of ways in which they respond, from bulk billing people to some kind of co-payment situation based on the person's ability to pay. And that's it in a nutshell. And so we've had really a bit of a movable feast over the last 3 or 4 weeks, where different iterations of these telehealth items, which we're relying on and so forth, have been coming out in different messages about, yes, you can bulk bill, or no, you can't ask for co-payments, and now there is an okay for that to be done. In all of this, what we've got to say to ourselves and to our clients is, what is a reasonable outcome here? There are some people who might need to see you a couple of times a week because that's where they're at. And we need to talk with them about how is that going to be a feasible process given fees and so forth. Would they be interested in potentially using up their 10 sessions relatively quickly, but then paying a small amount after that, like they would have paid a co-payment, that would then allow them to continue to have access to your services. This is another way of looking at this in terms of, we've got lemons, let's make lemonade, so that's one way I know that certain practices are dealing with it, by offering their services to the tune of the co-payment, or what the co-payment would have been once the Medicare entitlement runs out. There are ways around this. We can do it. I think we have to be responsive to the circumstances that people find themselves in.
Thank you very much, Kaye. We've run out of time, so I might not go with that slide that I was alluding to. But just wanted to thank you, Dr. Kaye Frankcom, Kaye Frankcom Consulting. I'm going to put there's links to your website and an ability to contact you, Kaye, in the post associated with this live stream. Will actually remain recorded online, so to be a useful resource for people to be able to come back to, and certainly know how to get in touch with you as well, Kaye. So thank you once again for coming on board. Thanks for the questions through today, and for the people who have come along and spent some time with us today. So have a great day, everybody, and we look forward to speaking to you again soon.
Bye for now.